We have now completed our 15-part curriculum on One World or None, or the causes and cures of the current world order that has given rise to unfit leaders and our current death spiral. For the next 15 weeks, we will deal with special topics and possible solutions. Today, we will discuss the next pandemic, which is sure to come. Many are projecting that it will be worse than the last one, and that we will be even less prepared. We can be sure of one thing: we will again not have the fit leadership necessary to deal with it. If the last Trump administration facilitated the first global pandemic in more than 100 years and caused more than 1 million deaths in the US alone, we are likely looking at 10 or 20-fold that number under the current administration. This is a stark illustration of our state of consciousness directly translating into physical effects. It can be the difference between pandemic and no pandemic, minimal suffering versus maximal misery, mutual cooperation to quell the disease, which was possible to do within weeks for COVID-19 had we strictly followed public health protocol, versus allowing the disease to quote-unquote conquer us. Far from being irrelevant and immaterial, consciousness is the source of all manifestation. It also indicates how our current death spiral is not inevitable, and with proper education of the public, the worst outcomes can be avoided. Theoretically, even a pandemic could be avoided. In March 2020, immediately within days of the belated announcement of a COVID-19 pandemic in this country, we at the World Mental Health Coalition issued our prescription for survival, which said the following: we are all health professionals. We are committed to public health and the Hippocratic Oath. Many of us are psychiatrists and mental health professionals. We have warned since 2017 about the dangers of Donald Trump as president, not about his policies, but about his mental condition and how his impairments seriously jeopardize our nation and the world. We held an ethics conference at Yale School of Medicine with the nation's foremost psychiatrists that led to the public service book, The Dangerous Case of Donald Trump. Thousands of mental health professionals joined us to form the World Mental Health Coalition. We then held a major conference at the National Press Club in March 2019 with 13 top national experts in fields such as law, political science, nuclear science, and climate science. We have tried to educate the public in many forums, including media appearances, about the deadliness of his symptoms. Now we conclude it is our urgent responsibility to inform the nation of what we consider to be a prescription for survival. If Donald Trump were president of any major institution, it is likely the board of directors would have required him to undergo a comprehensive mental health assessment. If he were any law enforcement or military officer, he would have taken a fitness for duty test before even assuming his job. All of our country's military personnel who handle nuclear weapons are required to submit to rigorous psychological testing yearly, except the commander-in-chief. Hence, we have a presidency that is incapable of protecting lives, but is making a global pandemic deadlier, not just through incompetence and ignorance, but through a dangerous detachment from reality, an inability to care for its citizens, a need to convey false information, and other symptoms. Our prescription is one or combination of the following. Number one, invocation of the 25th Amendment, as this president is so gravely mentally incapacitated that he is an imminent danger to the nation. Number two, a new urgent impeachment with televised hearings of the president's handling of the coronavirus pandemic, and the US Senate realizing this time that its decision involves the very fate of the nation. Number three, immediate voluntary resignation of the president with the US Congress granting immunity from prosecution. Number four, emergency court-ordered involuntary mental health evaluation by a team of medical professionals, and follow-up with recommendations. Number 5, complete removal of decision-making about this public health emergency from the president, accompanied by emergency congressional legislation to establish a coronavirus crisis department headed by the Center for Disease Control and Prevention personnel, with whatever funds and authority it deems required. And suspension of White House press conferences about coronavirus, which should now be held at the CDC headquarters with no political interference. The major press may make additional determination to attend only the CDC conferences on matters pertaining to the coronavirus. We further add that the start of this prescription is stat. Compliance could be life-saving. We issued this on March 25th, 2020, and said it was effective until fully executed. We said from the very beginning that all these issues relating to the novel coronavirus should be handled not by the president, but by medical experts. At this time, there were just 1,000 deaths, but we knew that far more would soon come, exacerbated by a mentally impaired president who said and did things troublingly and wrongly at a critical moment that would exponentially increase the spread for years to come. Because public education is one of the most critical interventions in public health, the restraints the president placed on medical experts, not to mention the disinformation he spread, which accounted for almost half the global disinformation on COVID-19, we believed it was our responsibility to voice our serious concerns. We warned that a man with this dangerous mental impairments would not be able to handle a crisis rationally and appropriately. And since severe symptoms, such as delusions, are contagious, we emphasized that we needed to address the mental health pandemic if we were to contain the COVID-19 pandemic properly. Had our prescriptions for survival been followed, the great majority of COVID-19 deaths, estimated at 70 to 99% at the time, could have been prevented, and the tremendous economic and moral injury not occurred. When months passed with little progress made, we issued our first prescription refill in August 2020, when there had been 175,000 deaths and already considerable economic devastation. Finally, we issued an emergency update in December of 2020 at a time when about 3,500 people were dying daily, and the overall death toll was now about 350,000. It said, now in our urgent emergency update today, December 21st, 2020, we are advising the president-elect to step forward much more forcefully and impress upon the country the urgent imperative to act as the UK, Germany, and other countries have done. Clearly, the Trump administration has grossly failed our country and is guilty at least of criminal negligence for mass death. Had our prescription for survival and refills been heeded, the great majority of American deaths would have been prevented. Instead, we are on the way to 500,000 deaths, unprecedented triage in hospitals, and economic devastation of immense proportions. Most Americans will soon be dead in 1 year than have been killed by all terrorists and foreign enemies combined in the past 100 years. Our country has by far the greatest number of deaths and COVID-19 cases of any in the world, at the rate of about 5 times the world average, which includes all third world resource poor countries. When government officials, regardless of party, present not merely a different ideology or approach, but widespread mass deaths, devastate the economy, and reform people's thoughts so that they are unable to act in self-interest, they present a public health hazard that becomes the responsibility of health professionals. That was our emergency update. All of our prescriptions can be read on the World Mental Health Coalition website. And then in the 2 years after our initial prescription for survival, and largely because of the former president, as confirmed by Lancet and other respectable scientific publications, there were nearly 100 million COVID cases and nearly 1 million American COVID deaths, more than in any other country. Our own distinguished Gerald Post was among them. And the BBC published a chart that is quite impressive in May of 2022, which you can see on my Substack. So now it is May 2025, and with Donald Trump back in the White House, and in all probability a new pandemic looming, for which we will be less prepared. When he became president the first time in 2017, one of the first things he did was to decrease funding for the CDC, including specifically for the departments responsible for monitoring viruses and preparing to prevent pandemics. We also know that there were urgent government meetings in January of 2020 among experts warning that a pandemic was imminent and that immediate steps were warranted. But the president stood in the way, insisting that he take charge, ordering the experts to step back and proceeding to give press briefings from the White House. That is when and why we immediately issued our first prescription for survival. Now, among the first executive orders he issued are ones that greatly increase our vulnerability to the next pandemic, be it bird flu spreading among humans or something else. Most egregiously and unconscionably, he ordered the US to withdraw from the World Health Organization, going so far as ordering all government persons at the CDC, the National Institutes of Health, and beyond to cease any contact and coordination with the WHO. This is actually devastating for the whole world. Furthermore, he ordered more significant funding and personnel cuts at the NIH, the CDC, and the Department of Health and Human Services, the very opposite of what is needed. And the urgent steps to prevent, or at least to minimize the impact of the next pandemic, are being undermined. While we have covered a lot of gloomy news today, I would like to emphasize that hope begins with a correct assessment of reality. Only then will we respond with life-affirming ways that improve the actual situation. And all begins with this realization. We are now preparing to issue Prescription for Survival 2025, which will be the topic of the next few weekly sessions.